2 millimeters was 20 millimeters.
Whoa.
What the mind doesn't know, the eyes don't see.
Take a minute, stop and make your legs rest.
Varicose veins, unfortunately, is the commonest problem in the world.
Shocking thing to understand that there's something happening in our body only because of gravity.
Towards the end of the day, they start getting pain in the legs.
I might be having those. Namaste, hello and welcome back to the podcast. Today I have a very interesting personality sitting right here with me. We have Dr. Jaisom Chopra, who specializes in blood vessels. It's as simple as what I understood without a doctor's background is we have blood flowing all over our body, which reaches every organ. So if you have any questions about the blood flow and the arteries and the veins, we have the expert here. Hello sir, welcome.
Hello, thank you very much.
It's an honor for me being in your presence here, sitting.
Thank you.
Before we go on to your expertise, before we start talking about the topic that we have here today, something I was very interested to know is your name, Jaisom Chopra.
Yes, it's a very unusual name.
Yes.
And I don't think many people have heard about it, and many people, really it's very rare, not only in this country,
Yes.
but even abroad. They have Jason, which is the
Yeah.
British god, but they don't have Jaisom anywhere else. When I put it on the Google, I get it straight away. It's very at once. And this really means, Jai means victory,
Yes.
and Som means moon. So if you put the two together, Jaisom really means a saintly person. Not that I'm saintly, but that's how it looks to me. And it says according to the name.
You are saying that you have no idea about being saintly, but he's very sweet, very down to earth, and we are going to learn a lot today. We are going to have an interesting conversation. So as you know, we were talking, we are going to talk today about varicose veins, something a very alien term for me and I think our audiences who's listening. What exactly are varicose veins?
Varicose veins have always been a very neglected branch, because people worried about the heart, because if the heart stops, people die. And they worried about the lungs, because again, if you don't breathe properly. So the varicose veins and the veins did never take priority. Now varicose veins are very important constituent of the body. Why? Because the bloods get oxygen and nutrition all over the body and give it to every cell, and you know there are billions and billions of cells in our body. So all the wastage from these cells after they take the nutrition is to be sent back, and that is via the veins which take it back to the heart. Now once they take it to the heart, it is recircled, and that is why veins are very important. Now if the circulation stops for even a minute, people, or a few seconds, people die. So that's how important circulation is. And it's unfortunate that it has been really neglected. Till now people talk of the heart and the arteries, but still veins are not considered very important. Though now a lot of priority has been given to them, and people have realized that these are important, and though they do not kill people, but they make their life miserable. And so they are terrible. They feel all day and night like they have got pain in the legs, they are shuffling legs all the time, they can't talk to you because it's very uncomfortable for them. So that's how veins do.
Something very surprising that I've never heard about it. As you mentioned, one of the very neglected aspects of the veins and the blood flow, something that I think we never understand, but something who's going through it will can a person who's not an expert, if I look at my hands and body and the veins that are visible, do you think that as a person I can diagnose it, or only an expert will be able to diagnose that?
Well, till now we were talking of normal veins.
Yeah.
Now you don't need to diagnose something normal,
Yeah.
because that's in all of us, everybody, so we don't need to diagnose it till things. It's only you make a diagnosis when problems start.
Yeah.
And when people have complaints, they say that that means something, body is telling you something is going wrong with the veins.
Yes.
Now what could go wrong with the veins? If you think of any pipe, it can increase in size, it can stop because of blockage, and that is main two things that can happen to any pipe. Now when they get blocked, we call it DVT, that means blockage of the veins. But what we are talking today of is when they are dilated. Now once they are dilated, dilated means increased in size. This size could be many fold than what the normal size is. Now once they become that, because they are so thin, they become tortuous. And if you see, that is what it is. If I show you a picture of these, you'll at once come to know that this is what varicose veins are. For instance, here, if you see this, these have got varicose veins. You can see on the leg how big they are and how ugly they look. And that is why, if you see in the West, people come immediately and get something done about them, especially abroad. If you see these people abroad, they wear skirts, the women, so they don't like the look of things, whereas in our country, because people cover their legs, they wear saris, they don't really worry about it for years. And I've seen many people go on and on with ulcers, become terrible, and they still don't get anything done about it. That's unfortunate, because they are leading a life where very uncomfortable and something which is totally correctable. There are many diseases that are not correctable, like cancers, maybe they are not, so many of them. But in this thing you can correct most of it, but why do you want to be uncomfortable? And it takes just a few minutes, an hour or two to sort it out.
Oh, okay. Something that we like to understand is that what are the symptoms? How does one person knows that they're going to get or they're getting varicose veins?
You see, it all starts with people having pain in their legs.
Okay.
Now once they get pain in their legs, they don't understand why it is happening. And towards the end of the day, because they keep standing and they keep standing and they keep standing, towards the end of the day they start getting pain in the legs. Now they just put it down. Today I was very tired. They try to believe them, convince themselves that it's because of that and nothing is wrong with them. Then after a few months to a year or something, this goes on and increases. Then they find that putting their legs up, they feel better. And that is because they're trying to reduce the pressure by putting their legs up against gravity. So once gravity stops working, that means they put their legs up, they feel better. Then they also feel better that somebody presses on their legs. Some of them tell me, the patients, that we ask our children to stand on our legs when we come back. But even then they don't realize that there is something wrong. And they don't worry about it. Why? Because their legs look normal. Then over years, then they start finding a small bulge. And that time they say, oh, somebody says what has happened, or they feel that there's a bulge. They may come at this stage to us. Or they may come even later when they find the discoloration at the ankles. Now what I showed you in the picture now is where there are bulges. But they may come at a stage, I'll just show you that stage, when the color changes start. And when the color changes start, for instance, this color change. Now here they find that little bit the color changes around the ankle, and at this stage somebody in the party says, when they're sitting up, that look, there's something wrong with your leg. And then they go to us, and at this stage already over 10-12 years have passed when the thing started. So there. And in women mainly they start in pregnancy, and every pregnancy makes it a little worse, and I'm not going into why it takes place, but that is where it starts.
I'm a little worried after listening to this, because when you listen to the symptoms, is something that I might be having those, but I think we'll come to a diagnosis later. And but when you hear about these symptoms, one thing I want to understand is that why are we talking about varicose veins? And why I'm asking you this is that I heard while we were having conversations earlier that is this very common, or?
Varicose veins unfortunately, is the commonest problem in the world.
Okay.
Now, I'm not talking of India, I'm not talking of Africa, I'm talking of the entire world. Now, they say that 60% of the population, that means if there are 100 people, 60 people are going to get varicose veins or venous problems somewhere in their life. And I have also seen that that is absolutely true. Many people don't come to you because they keep convincing themselves there is nothing wrong. Now, because they are so common, now you'll say, why are they so common? Yes, now we have come over the phase of corona.
Yeah.
We found that everybody, we all wore masks, and we said, don't talk to anybody, don't remove your mask. Why? Because the viruses travel through air, and air is a medium which is of nature, which is carrying the virus. And because air is everywhere, viruses travel to all of us.
Yeah.
Similarly, water is another common medium all over the world. When there's diarrheas, the whole community gets it. When there are dysenteries, whole cities get it. How come everybody gets it there? Similarly, there has to be a medium in this case also which causes it, and that is gravity. There is no place in the world which is without gravity. I mean, you can go to England, you can go to Timbuktu, you can go to America, gravity is there, and wherever there is gravity, there will be varicose veins. Why? Because of the pressure the gravity is causing and dilating these veins to become varicosed.
So, when we come to causes of varicose veins, is it only gravity, or is it something that we can avoid when we look at the causes, and why is it happening?
So, as you ask me that is the gravity the only cause of varicose veins? The answer is, it is one of the promoting causes of varicose veins. It causes increase in the varicose veins, but what really starts the varicose veins is the valves inside our legs. Now, in the rest of the body there are no valves inside the veins, but in the legs, starting from the belly button downwards, the valves increase progressively, and these are one-way valves. Blood cannot return.
Yeah.
For instance, when I stand, everything falls due to gravity. Everything collects and falls due to gravity. But varicose veins, your blood goes against gravity back to the heart. Why is that? Because your calves squeeze the blood vessels and it goes up, and these valves open, but they do not let the blood fall back. So they close and they don't let it, and that is why the blood in the legs goes by jerks. Like that it will go. It will never go smoothly, and that. Now, in varicose veins, what happens is they are dilated veins. Because they are dilated, the walls are separated, and because they have separated, the blood falls back through these openings because they are separated, and that basically is varicose veins. Now, once this starts, gravity works rapidly and pulls it more and more. So, more and more pressure breaks, the veins become more and more dilated, and because they become more and more dilated, they increase in size. So, that is the reason and how varicose veins forms.
Now, the explanation that I just heard and understood is the scientific and doctor's terminology putting in. What I'll just, when I say the causes, as a human being, as a person who has no idea about this disease or the problem, what can we do to avoid it, to prevent it, so it does not happen?
You see, for varicose veins, there's nothing you can do to avoid it really, because once they start,
Okay.
the only way you can do is to slow the process.
Okay.
Now, till now, people do not know if it is frankly genetic or not, though it runs in families. There are many times I see people having varicose veins, their fathers had it, their grandfathers had it, and they've got it. Now, sometimes they arise de novo, that means without any cause, and they don't, like standing jobs. So, therefore, what happens is people who stand a lot, like you get teachers, very common in them, army personnel, police personnel, the people who have standing jobs like salesmen, saleswomen. So, there are people who keep standing, due to the action of gravity this. But do everybody get in gravity because of gravity? No. Why? Because if they have a competent valve, then this does not take place. It can stand the pressure. But over time, you will find that due to gravity, it becomes much, much worse.
Something this is coming as a quite shocking thing to understand, that there's something happening in our body only because of gravity and we can't do much about it. So again, we can't prevent it. We can just slow down the process.
We can slow down the process, but there's no way you can go ahead and prevent it from happening. At least till today, it's not known if there is any way you can prevent it. You can slow it down. The only you can do is to operate and destroy it so that it doesn't form again, but you cannot prevent it at any time when it comes.
So when we say that, these varicose veins, once they reach onto particular stages, will have the visibility on our body. So if it's not visible, are doctors also not able to diagnose it, or how is it diagnosed?
How right you are. That is my main problem when I give talks outside. I know that the doctors in many cases, I must say more than 50%, if they do not see the varicose veins, they say आपको varicose veins नहीं है. Now in these type of patients, I'll give you an example of a patient of mine who was a lady in Srinagar, and we had gone for OPD to do outpatient department, and this lady had got pain in the legs for the last 5-6 years, and it had made her life miserable. She could hardly walk, she could in bed at night she had pain all the time. So when she, naturally the doctor who was taking care of, sent her to the orthopedic doctor and said, you go to the orthopedic doctor, he may be able to do. The orthopedic doctor took x-rays of the bones, of the joints, and he found that everything is normal. So he sent her back with painkillers back to the GP. So she went back to the GP, and after a few more months she came back and said, look, my problem is not solved. So he said, okay, you go to the neurologist. That is the doctor who deals with nerves.
Yeah.
And she went to the neurologist and who did a scan, MRI of the lumbar spine of the brain, and said that, look, I can't find anything wrong with you. And then she came back to the GP. And then finally the GP got so fed up, and that how much this lady is going to be, I can't do anything with her. He sent her to a psychiatrist.
Okay.
Now this lady said, मैं पागल तो नहीं हूँ, तो मुझे दर्द है. And ultimately what he did is, when I went over, she very sheepishly came to the OPD and said, I know doctor, you can't help me, but this. Now the only thing I found out looking at her, she had got quite obese legs and all, and because the doctors had not seen her, they did not know. So the only question I really asked her was one. I asked her, do you get heaviness in your legs? Because whenever you see the blood is standing in the legs and the veins are dilated, more and more it will become heavy. So these patients do get pain, swelling of the legs and heaviness. Okay. So I asked her, do you get heaviness? And she told me in her own way, she said that, and I knew straight away that this lady has got a problem that is there. So I told her to lie on a couch and did an ultrasound on her. And what vein in the groin, which should have been 2 millimeters, was 20 millimeters.
Whoa.
It was 10 times dilated, and similarly down her leg. And round her ankles, there was a little bit of color changes which I found. So I told her, I said, why don't you come over to Delhi? And she came over to Delhi, and in Delhi, I quickly did an ultrasound on her and operated upon her, and I found that the lady became perfectly all right. The treatment for varicose veins is basically removing gravity.
Okay.
Now gravity we know we cannot remove. So most of the patients I give anti-gravity measures. And what are the anti-gravity measures? Keeping the leg elevated. Now at night I tell them that put 2 pillows on below your leg and elevate your legs. And during the day, when you're standing, because naturally they have to walk, they have to wear tight stockings from half the foot till the knee. I do not give above that because India is a hot country and it's very difficult. So the basic treatment for varicose veins is elevation of the legs at night and the whole night without stockings, and to wear stockings right from the time you get out of bed in the morning till you get into bed at night, except when you're going to take a bath. So you wear stockings right through the day except when you're going to when you're going to take a bath, and when you're sleeping at night you do not wear them. Now these two things are the basic treatment for varicose veins. There is no medicines, there are no oils, there are no creams which the people are today advocating for varicose veins, and there is nothing you can do to prevent them except these two things. What these two things are only delaying them, not preventing them, but delaying them, and there is nothing you can do about it.
And there's no treatment for it?
The treatment is surgical. Now surgical treatment is very simple. It is just like a blood test. The way the nurse draws the blood from your hand, I put a needle under ultrasound control into the dilated vein below the knee.
Okay.
And from there I put a wire. That wire goes up to the groin because all the valves start from the groin. They start from above, but the main thing, they start from the groin. And that wire is heated to 180 degrees Celsius,
Okay.
sorry, 120 degrees Celsius. And because of that heat, it suddenly, the whole vein collapses and becomes like a cord. Now, when I keep pulling it out, this vein progressively becomes like a cord and becomes hard and will never come back. That means the pressure is removed because the vein is gone, and the blood is going to go via the deep system. Now you will be saying that, okay, when the vein is destroyed, how does the blood go back? There are two veins in our bodies. One are the superficial veins which I am going to destroy, one are the deep veins which lie deep to the muscles, and this is the main vein, and the blood then goes via that, which I am not going to touch. Therefore, any patient that comes when I am going to go for surgery, I do always an ultrasound to be sure the deep system is open and does not have any clots, because if he's got clots or she's got clots, there's no way I'm going to operate upon this patient, because otherwise how does the blood go back? Both systems are closed. So I'm very careful about that.
So when we talk about the stages of varicose veins, I got a chance to look at the pictures, and I was seeing a lot of worsened cases. What are those?
Well, the stages of varicose veins are very straightforward. They're all due to pressure. The first is the patient says, I've got pain. Then he says, I've got swelling, which should happen because the pressure is so high. It is going to, the water is going to seep through. What is edema and what is swelling? It's only water, and therefore it's going to seep through under pressure. The pressure is so high, it just seeps, the water seeps out into the thing, giving rise to edema or swelling. Then slowly over time, then the patient starts getting a bit of discoloration, feels it heavy. Firstly, if he starts feeling it heavy, I told you about the lady who was feeling heaviness in her legs, and that is why, because more blood is standing. Now once that is taken place, then you find there are simple color changes, like I will just show you a thing. Now if you see here, this patient has got the small veins which are present at the ankle. Now this is the next thing that happens when you get this. Now if he doesn't even care about it, he says, nahi kuch nahi hua, that has not happened, then this happens where the color changes are even more. Now this time the body is telling the patient, to us, that look, do something about it, otherwise we are going to have problems. But most people I find at even this stage, they don't care about it. And then what happens? Then the color changes even more. It becomes black. Now the patient at this stage gets little worried that it is different, something has happened to my body which is becoming black. And if he still ignores, then this is what happens, an ulcer. Now this, if an ulcer ever takes place, you can imagine he's got to do putty all the time, he's going to have the wounds which are weeping all the time, there's water coming out of them, and their life becomes miserable. Now why have we to reach this stage to make our life miserable when it is easily correctable? That is what I really am surprised. And as you told me, many doctors do not know, because the patient has got, if he doesn't have visible veins, they don't diagnose it. Like I told you about the Kashmiri lady. So there, that is it. And that is why this, of course, is good that talking another thing about varicose veins. I remember another incident where a patient had operated about 15 years ago for varicose veins, and he never came back to me after that. Then he went to an orthopedic surgeon because he had got orthopedic problem and they had to lengthen the tendon at the ankle. So there was a cut in that place, and now when the thing was done, the operation was done beautifully, there was no problem. The stitches were removed after 2 weeks and they broke down. So the patient had an open wound. So then the doctor, what he did was he quickly sutured it again and said, don't worry, I'll remove it after 1 month. And when he removed it after 1 month, it broke again. So the whole wound opened. And then he got worried, so he sent it to a plastic surgeon and said, look, I can't deal with it, this man is opened up again. And the plastic surgeon said that, oh, don't worry, I'll put a skin graft on it. So he put a vac dressing and then ultimately a skin graft. And once he opened the wound with skin graft, the skin graft broke down and did not take. So he didn't even understand. And this time about 2-3 months had passed and the patient was fed up. So he came to me, he says, oh, I remember Dr. Chopra told me about veins which I had so many years ago, let me go to him. So he said, I am sure you can't help me, but this is the problem I've got. So I told him, lie on the couch, and I did an ultrasound in him and I found a very large perforator, means a large vein coming straight and feeding that area. All I did was to take him to another room, I injected that vein, blocked it off, and that wound healed in 4 weeks. So what I'm trying to say is not that there was any greatness on my part, but the only thing was that people did not know. It is just that what the mind doesn't know, the eyes don't see. So that's it.
So that's a lot of new information that we learned today, me, our listeners. Something I am still worried about is general people. This is so common, difficult to diagnose. And when I was looking at those ulcers, the pictures that you were showing, these cases, they do look ugly, they don't look good. And I don't know, I mean, people are not aware about it. Yes, now they'll be much more aware, but how do you handle patients who are coming to you and being at these stages, already having ulcers, and how do you handle it?
Well, I just feel one should not land up with an ulcer if possible. He should be aware of it because body is going on telling him problems are arising. Why is he going on neglecting them? At a stage when he can easily do it, avoid all these complications like ulcers, color changes, other large veins, he can avoid all these complications, but he doesn't do it. However, you find them all over the world. People neglect themselves, they come at the stage of the ulcers. Once he's come at the stage of the ulcer, remember, operation has to be done. Varicose veins have to be treated. Why? Because the varicose veins are causing the ulcer. Till I don't stop the varicose veins, it's only going to worsen. There's no way I'm going to concentrate on the ulcer. So I treat his varicose veins. Now you'll be surprised, even at an advanced stage, many of the ulcers totally heal. But however, if an ulcer is very ugly, if it is very infected, then it may not heal. In that, having done the varicose veins, because varicose veins I will do, you may find that there is a perforating vein. Now, what is a perforating vein? It is the connection between the varicose veins and a deep vein. I told you there are two veins. One is the deep veins, one is the vein above the varicose veins. So those connections are there around the ankle and all. So then those I block off and most of the ulcers do heal. Now almost 90% of the ulcers heal on their own without any problem. But if an ulcer is very bad, it is connecting to the bone and all, then I may need skin grafting, may need.
Okay.
But I really don't think many cases would be there where you don't do it. Now once the ulcer forms, that means an open wound. If there is an open wound, he can get infection. If he can get infection, then the leg can become swollen, heavy, red, which means cellulitis takes place. Cellulitis is infection of the leg, and I've seen many patients come to the ICU straight, become septic. Septic means they get into the bloodstream, they get all the bugs into the bloodstream, and I've seen people die. So here's the thing which is totally preventable, and because the patients are negligent, or maybe the doctor did not see, whatever the reason is, they should be careful if they get ulcers and do that.
So while we are talking about ulcers, something I want to also understand, a lot of people would like to know how cost effective these surgeries and treatments are if somebody needs to come and get themselves treated.
Well, a first stage, what I said, when they get pain and swelling, they have to wear stockings and elevation. That's hardly going to cost them very much. A stocking may cost them about 4,000, 5,000 a pair, 4,000 a pair, and which goes for 6 to 8 months.
Okay.
So they do that, and by that they'll be prolonging time. Now remember, once the valves are gone bad, there's nothing anybody can do. They will always progress. You will only make yourself more comfortable. Then as the pressure goes on increasing, even your stockings become a problem. At that stage, when the veins start becoming visible, get them done. Once you've got them operated, but most people get very worried about operation because they think that operation is the end stage of everything and all. No, that's wrong. Varicose veins, you don't have any cuts, your legs are exactly the same, you don't have any problems. Next day you're going back to the work. It takes me 1 hour each leg, that's all, and after 3 hours you're walking, you're eating, and then next day you can go back to work, as I told you. Only 3 months till 2 months after I give stocking, because some swelling may come because of the procedure itself, because I burnt it, and that is it. But otherwise varicose veins, I think, should be, the fear of varicose veins should go away. As far as the cost is concerned, it varies from place to place. Normally, like the catheters which I use are obviously very not available in India, and they come from Germany. They may cost up to 60,000, but 60,000 goes for 4 or 5 people, this catheter. So about 15,000 that. So maximum both the legs, approximately you can say with stay, everything would be 1.5 lakhs, approximately. That much it would come to, 1.5 lakhs.
In general, when you were talking about the stockings, are these any special kind of stockings that?
Yes, these are known as graded compression stockings. Graded means the pressure is higher at the ankles, and as you go up the leg, it becomes less and less and less. So they are known as graded compression stockings. They are available everywhere, and they are made to order. Many times you can get them off the shelf, and they are very tight. But most people, I find, just because they don't like anything around their legs, they don't wear it. No, just wear it, you'll find yourself very comfortable. Forget 2 days when you feel uncomfortable, but that is all psychological and mental. there you feel that way. Once you start wearing them, like I am wearing them now, like I told you, and I have no problem at all. I'm do my work normally, I operate normally, I do everything. Similarly, so because we did not wear it all our lives, so we won't do it now. But then all our lives we didn't have varicose veins also. So why not to wear them and become all right?
Yeah. Before we go on to this is a very interesting conversation and we can go on, but before we try to sum it up and conclude, this might be Behti Ganga mein haath dhona, and this would be a personal question, can be related to varicose veins and also not be. Something that I have seen in my family history, I've seen particularly a lot of ladies complaining about it, that having a lot of leg pains throughout, and again, if you rest your foot, if you elevate them, then you're feeling comfortable. If not, even if you're not standing, your legs are paining.
Well, as I told you, they are very common during pregnancy.
Yeah.
Why? Because the uterus as it enlarges, it presses on the veins, and because of the veins, there's like a dam is created, and the veins dilate. Now, after the pregnancy, they disappear, but there is some residue which is left of dilatation.
Okay.
Next pregnancy, third pregnancy, they become obvious varicose veins. You don't have to, once they are there, you don't have to worry very much about that. Just elevation and stockings you have to wear.
But this is again something where we're talking about ladies who are above, a particular age group and have gone through pregnancy. I'm talking about, women who have not even been through that experience.
Yes, there are many which do get varicose veins. I've seen I've operated on people from 14 years till 92 years. Okay. Now, you can imagine age is no bar. Was once commoner in women, but today sex, they are equal ratio in this thing. So the only thing I would suggest is when you're getting a problem, any lady getting a problem with pain which is making restless, but the legs otherwise look well, please get an ultrasound of the legs done. Okay. Ask the radiologist to do this ultrasound standing and lying, and your answer will be known. You'll just simple ultrasound which takes hardly 20 minutes, half an hour, and there is painless. You just do that and you should be fine with that. You'll reach a diagnosis, and then if you've got varicose veins, you go to a vascular surgeon. If you don't have varicose veins, wear elevation stockings. Why? Because the elevation and stockings will relieve you of your pain. But you must then look for other causes like spine. You may have a lumbar disc stenosis, which means you've got pain in the legs. Now that is not related to this. Arterial causes mostly in women are not common. They are in smokers and that's not very common. But yes, arterial pulses the doctor will have to see. So very simple diagnosing and excluding other things without much problem.
One last thing, could be a doubt, something that I wanted to understand is that I was also discussing it with Dr. Jaisom earlier, that while even sometimes while I'm sleeping, I might not feel that my legs are rested. I feel that they're shuffling, they're moving. I need to make myself understand that take a minute, stop and make your legs rest.
Well, in that case, maybe you don't have obvious varicose veins, but the pressure is increasing. Now, sometimes around the calf muscles, the perforators increase the pressure. Now, we are not going to go into all that, but first try elevation at night and stockings during the day. And if it still continues, next is an ultrasound of the legs for venous system to exclude DVT and varicose veins. Just do that and then we'll go on further after that.
One last query. This is a very public query. A lot of people were asking when they got to know that I was going to have this conversation. In Hindi, generally बहुत बार ऐसे होता है कि हम लोग बोलते हैं कि हमारे पैर में नस पे नस चढ़ गई है. Now, because you are an expertise in blood vessels, as a layman, I just want to understand, is this something related to blood vessels?
Yes, one of the things about varicose veins is night cramps,
Yeah.
itching and night cramps.
Oh.
Now, itching is sometimes people say kharish ho rahi पैरों में, goes on and on.
Yeah.
I'm not talking of dryness. Dryness may give rise to itching, but varicose veins does give rise to itching. Why? Because of the red blood cells which carry oxygen, they leak from the veins into the tissues, giving rise to itching and color changes. So itching is one something which is very common among people, and night cramps. Many times people say रात को बहुत cramp पड़ते हैं and all that. It is again due to increase in venous pressure. That is why they have this.
Cool, that was a lot of queries answered, a lot of lots and lots of alien information that I have learned today, and I am much more aware about it. I hope that you also had an interesting time with us and learned a lot. With that, ladies and gentlemen, we were with Dr. Jaisom Chopra, who is an expert in blood vessels. If you feel that you want to ask him something, you have any queries, please reach out to Apollo Spectra Hospital. Dial on to the helpline and you will be able to get in touch with him. With that, thank you so much for being here. Thank you so much, sir, for being here and giving us your time.
Thank you very much.
With that, thank you everyone. Do keep listening. We'll see you in another episode. Keep listening and subscribe. Thank you.